Well, hello guys, good evening. Well, first of all, let me welcome you to this class. And as you might have received an infographics from the coordinator, who is Allison, in which you might all already have seen the topics that we're going to discuss for today's class, which would be medical practitioner, nurses, and health professionals, associated health professionals, right? And the last part of this class would be about some facilities of a hospital, right? So let's get started, okay? So let's begin with this. What is a medical practitioner? Well, a medical practitioner is also known as a physician, okay? In American English, that would be English from the United States, right? So, what is a medical practitioner? Is a physician, medical practitioner, or medical doctor, or just doctor. I mean, there are a lot of synonyms that are related to this term, okay? So, this professional is a professional who practices medicine, which is concerned with promoting, maintaining, or restoring health through the study, diagnosis, prognosis, and treatment of the disease, injury, and some other physical disabilities that a patient might get to have. Okay, so I already told you, the medical practitioner, this term, has a lot of synonyms. Okay, it depends on the country you're in. Okay, for example, as I was saying, physician, this term physician, is commonly used in US English, United States English. Okay, medical doctor is in Commonwealth English. I mean, in every country that you might work or study, the term medical doctor, okay, or medical practitioner would be accepted. I mean, in every country, in any English spoken country, that would include the United States, the UK, I mean, the United Kingdom, Australia, South Africa, and a lot of English spoken countries. The term medical practitioner, medical doctor are commonly used. Okay, physician is mostly for the US English, as I told you. The term doctor is also used in several parts of the world. So there are a lot of synonyms for the term medical practitioner. Okay, okay, let's go on. So we are among a lot of, well, you are all going to be doctors one day after you graduate, right? And what about general practitioner? In the US, a general practitioner is also known as a GP, okay, due to its acronyms or abbreviation. Okay, so in the medical profession, a general practitioner is a medical doctor who treats acute and chronic illnesses and provides preventive care and health education to patients of all ages. So when you graduate, when you get your degree as a general practitioner, What is the main objective? We all start down below. We, as a general practitioners, we get to the primary care center. Okay, so uh, in primary care units or centers, a general practitioner manages all types of illnesses and that present in an undifferentiated way at an early stage of development, which may require urgent intervention. So, a general practitioner's main role would be to provide medical treatment, right? That's what we all study for. And a GP's role varies from countries or even within one country. In urban areas of developed countries, for example, the roles are, well, tend to be narrower and focused on the care of chronic health problems, the treatment of acute non-life-threatening diseases, right? Which means that conditions that do not threaten life right away, and the early detection and referral to specialized care of patients with some serious diseases. I mean, when this patient, for example, when a patient is critically ill and needs intervention from a specialized center, a higher uh, unit of healthcare, that is what a general practitioner has to deal with. I mean, this general practitioner receives a patient, and then its function would be to make a referral, okay, to a specialized center when it is a serious case of illness. Okay. Meanwhile, in rural areas of developed countries or in developing countries, a GP may be routinely involved in pre-hospital emergency care, the delivery of babies, community healthcare, and performing low complexity surgical procedures. For example, when you are a GP and you're on your shift, right? And you get a patient who has just had a fight, for example, and has a wound that needs stitches, right? That is what a general practitioner would mainly do, right? The stitches is a small surgical intervention. Also, uh, in some healthcare systems, GPs work in primary care centers where they play a central role in the healthcare system, while in other models of care, GPs can work as single-handed practitioner. Okay, so mm, in some types of healthcare systems, a general practitioner is like the center of the healthcare staff, right? And this term, general practitioner, is common in the United Kingdom, I mean the UK, right? Ireland, Australia, Canada, South Africa, New Zealand. However, in some other countries, this the word physician is largely like reserved for a certain specialized doctor, for specialist. In this case, general practitioner in some countries is related to uh, a specialty which is internal medicine. Okay, so this term, general practitioner, would depend on the country you're living in or studying in, right? Okay, so let's go on. So, what is an intern? I mean, we're looking at this medical stuff related grades, right? And what's next is an intern. Here in Bolivia, at least, and in some other countries, that is quite similar. An intern, a medical intern, is different from what it represents in the US, for example. Here in Bolivia, we have a 5 year study career, which is medicine, right? And right after the fifth year, the sixth year, uh, a medical student becomes an intern. An intern here in Bolivia is related to one way of, well, to get a degree, okay? Internship is one way to get a degree here in Bolivia, at least. It is quite different from an intern, what an intern is called in the US, for example. You might have seen some series in which an intern is already a doctor. And that's why I wrote this. What is an intern? Doctors, period. Okay. For example, in the US, an intern is already a doctor, has already achieved a degree, the degree of doctor. Okay. And this intern, since he or she is already a doctor, is going under guidance and supervision related education. So when a general practitioner wants to follow a specific specialty, becomes an intern under the supervision of different types of doctors that have a higher degree. Okay, and in the US, an intern is also called a first year resident. That is what we are going to talk about right now. So, what is a medical resident? A medical resident has already graduated from medical school and is undergoing a graduate medical education program or GME program. Okay. This medical resident continues his or her training in a specialized field. The result of residency, medical residency, is a specialist. On the other hand, we have fellowship. Okay, what is a medical fellow? So, a medical fellow is a person who has completed residency and elects to pursue further training. Okay, and the result of fellowship is subspecialty, a subspecialty. In this case, a subspecialist. Okay, so here we have the results of each process. A person who has accomplished the medical residency becomes a specialist, and a person who is already a specialist can go on to a fellowship. And when this person concludes the fellowship, becomes a subspecialist. Okay, fellowship is like well, it is related to subspecialists, right? But it also may be a requirement for some specialties. We are going to talk about later on about some specialists that require fellowship, and those other who do not need fellowship. Okay, so What is the next grade of a medical practitioner? That would be an attending physician. Okay, so an attending physician is a medical doctor who has completed all residency training, and they are board certified or eligible to practice independently in a particular specialty. An attending physician typically supervises fellows, residents, and medical students, and may also be a professor at an affiliated medical school. Attending physicians have final responsibility, legally or otherwise, for all patient care, even if the care is given by a subordinate. So they have a lot of responsibility, even if a subordinate has made a mistake. The attending physician is responsible for mm, his subordinate's actions. Okay. An attending physician is considered an expert in their field of medicine or surgery. I mean, we have two branches here, right? Medicine, which are related to internal medicine, pneumology, cardiology, endocrinology, and the surgical branch, right? Like urology, general surgery, orthopedics, right? So an attending physician is considered an expert in his or her own field. Attendings are also referred to as staff physicians, supervising physicians, rendering doctors, or just attendings. Okay, so in hospital, when we're talking about medical staff, these people would have a higher degree when talking about physicians that are related directly to a patient. And depending on the field of medicine, the route from medical student to attending can take several years. As one of your, as one of you just told us that in El Salvador it takes 8 years to become a medical practitioner. I mean, it's quite a lot of time, right? It's different than here in Bolivia, in which it takes 6 years. In some other countries, for example, I guess I sometimes I heard in Peru it takes a little more time than in Bolivia does, right? Well, it takes up to 7 years, I guess, or something like that, to get the degree of medical practitioner. So, since we are talking about medical practitioner, we got to the part of the specialty and the specialist. So here we related, here we have a board in which the specialty and the specialist name are related. Okay, so here we have the specialty would be gastroenterology, and the specialist would be a gastroenterologist. Notice the suffix ist. Okay, the ist suffix replaces the ending of the specialty word. Okay, so as one of you just I asked you to give me an example of any procedure or disease related to this specialty that you see on your left. With one of you, we were talking about um, ERCP, right? So we just talked about ERCP. When we study, for example, surgery, right? And we have this one famous disease, which is pancreatitis, right? The most common cause of pancreatitis is obstructions of the biliary ducts. And here we have this procedure that one of you mentioned, which is ERCP, which stands for endoscopic retrograde cholangiopancreatography, right? You must have heard and you must have read about it. This is a procedure in which X-ray are used, right? And they carry, well, the bile ducts carry the bile from the liver to the gallbladder, right? So when one of these calculi, which are located in the inside the gallbladder, it goes through the cystic duct and creates an obstruction at a certain point when where the bile duct connects to the small intestine, right? On the first part of the small intestine, which is the duodenum, right? And it causes the pancreas to still be secreting its enzymes, right? So since there's a blockage, it causes to it causes the inflammation of the pancreas, right? So we turn into the well, we take hand of this procedure, which is ERCP, right? Endoscopic retrograde cholangiopancreatography, right? In every book that I have read about this kind of diseases and procedures, it takes its abbreviation from the English name, because in Spanish it would be different. However, we always read it that way, right? ERCP. Okay. So the next specialty would be pneumology. The specialist is called pneumologist. Notice pronunciation. Pneumologist. Okay. So I also asked you, I asked one of you to tell me a procedure or a disease related to this specialty. And you told me about asthma. Yes, and it is related to pneumology. What is asthma all about? Well, asthma, as this person explained, is a chronic inflammation of the lower airways, right? So it is like the air can go in, but is trapped, right? In the outer and the peripheral airways. So that is correct. The asthma is a chronic inflammation of the lower airways, and we talked about upper and lower airways last week, right? So going on, we we have the specialty of cardiology. The specialist is called cardiologist. Okay. So when we were talking about when I asked you to tell me any procedure or disease related to cardiology, you talked about hypertension, and that is correct. Hypertension is a disease in which the blood pressure is uh, the levels of the blood pressure levels are higher than the normal, and they tend to damage some uh, organs in the long term, right? Which mainly are the kidneys, the heart itself, and the retina, right? So what you told me is correct. The hypertension is related to cardiology, yes. Going on, we have this next specialty, which is hematology. And the specialist would be called hematologist. Okay, so when I asked you to tell me any procedure or disease related to this field, you talked about anemia, right? And also leukemia. Well, anemia is related to the a person participated here and said that is a lower count of red blood cells, which could be considered correct, yes, and it is actually a more accurate definition of anemia would be a lower concentration of hemoglobin, okay, rather than normal. How do we define normal? Well, it depends. Depends on gender, depends on weight, depends on the altitude in which we live, right? For example, here in La Paz, we live in high altitudes, right? Above sea level. Here we live at it would be 3,600 meters above sea level, right? Yes. So it would depend on many other factors that make the hemoglobin levels vary from person to person, from country to country, and from different areas in one single country. So it depends on a lot of things. Okay, going on. Here we have the next specialty, which would be immunology, and the specialist would be immunologist. Okay, notice here that immunology is a little different from the word in Spanish, right? In Spanish, we have an INM, right? In English, it's IMM. Okay, immunology, immunologist. So next specialty we're going to talk about is dermatology. And the specialist would be dermatologist, right? So one of you gave an example of one disease that is related to sebaceous glands that make the skin greasier than normal, and that would have that would lead to the infection of soft tissues in and under the skin. Okay, so this is rosacea, right? This is a disease that can be taken as a differential diagnosis with lupus, right? So what would these both diseases have similar clinical presentation. Okay, when we're talking about lupus, it does not affect a skin fold between the nose and the outer angle of the mouth. Okay, and when we're talking about rosacea, it could affect this skin fold. Okay, so this is a tip for you guys to remember when we're talking about um, differential diagnosis. Take into account this tip. Okay, lupus does not affect this skin fold between the nose and the outer angle of the mouth. On the other hand, rosacea, right, does affect this skin fold between nose and outer angle of the mouth. Okay, so let's go on to the next specialty, orthopedics. Okay, notice pronunciation between, remember pronunciation when we have a T and an H, orthopedics. The specialist would be an orthopedist, okay? In Spanish would be traumatólogo, right? So, uh, an orthopedist would treat traumatic lesions on bones, ligaments, and muscles, right? Let's go on. So, next specialty we're going to talk about would be neurology. Neurology, okay? This specialist is called neurologist, right? So, when I asked you to give me one example about any procedure or disease related to this field of medicine, you told me, you told me um, multiple myel. No, sorry, you told me multiple sclerosis. Yes. So you explained a little bit, and you were right. It's autoimmune disease, right? That attacks the axons of certain neurons, which mostly could be motor neurons, right? It tends to be present in young men, right, rather than women. It's especially it especially presents in young men from 20 to 30 years old. I remember it is also related to people who are close to the equator line, right, in which there are higher temperatures. So uh, it tends to attack motor neurons, axons of the motor neurons, actually. So, clinical presentation, as you told me, and that was correct, um, there is some weakness of the limbs, right? And even it could cause it could also cause optical neuritis, right? And weakness of the muscles that are around the eyes and are involved with movements of the eye. So it would be related to diplopia, right? Yes, what you told me was correct. So next specialty would be urology. Urology. The specialist is a urologist. Okay. Next specialty is gynecology and obstetrics. Notice pronunciation here, guys. Gynecology. Okay. So the specialist is a gynecologist. Gynecologist. When I asked you to tell me any procedure or disease related to gynecology, you mentioned a procedure, right? Which is don't quite remember right now. Okay, let's go on to the next one, which would be endocrinology. Endocrinology. The specialist would be endocrinologist. Okay, as you know, an endocrinologist is related to the endocrine system that we already talked about last week. In diseases such as diabetes, type 2, type 1 diabetes, Addison's disease, hypothyroidism, right? Hyperthyroidism, a lot of diseases. So the next specialty would be ophthalmology, and the specialist would be ophthalmologist. Ophthalmologist. Okay. Next one would be otolaryngology. Different from the word in Spanish to refer to this specialty, right? A little different, not quite, but yes, it is different. And the specialist would be otolaryngologist. And remember, when we already talked about parts of the body, we talked about the larynx, right? That is what it stands for, otolaryngologist. So next one, and the last example, I guess, psychiatry. Psychiatry. And the specialist would be psychiatrist. Okay. So we already talked about medical practitioners. Now we are going to talk about nurses. Okay. So let's go on. There are four main levels of nursing degrees, okay, which would be nursing assistant, also known as CNA, licensed practical nurse, which would also be known as LPN, registered nurse, also known as RN, and advanced practice registered nurses, okay, also known as APRNs. So what are their main roles? Nursing assistant, also known as CNA. In Spanish, we know this nurse degree as auxiliar de enfermería, right? So what does this nursing degree is responsible for? Nursing assistants also go by the title of nursing or CNAs, right? While these professionals are not actually nurses, they are on the front line of contact between the medical staff and patients. And the role can serve as a starting point for many nurses. Nursing assistants bathe their patients and help them dress, eat, and use the bathroom, right? And perform other daily activities. They measure vital signs that we already said that they are usually known as vitals, just that. So they measure vitals, and since they are closer to the patients than some of the nursing degrees, right? They tend to listen to the patient's health concerns and transfer patients between beds and wheelchairs, right? You also know what nursing assistant does. Some of the CNAs also may dispense medication according to the disease that this patient might have. They At the CNAs are often the principal caregivers in nursing homes and residential care facilities, having more direct contact with the residents than other staff members, right? So they tend to be closer to the patient when we're talking about some medicine administration, um, feeding them, helping them get on the wheelchair, to bathing them, and all that kind of activities, right? So next would be the licensed practical nurse, uh, also known as LPNs, right? Sometimes They are also known as licensed vocational nurses, and they're responsible for a variety of patient duties. They monitor patient health and administer basic care. Their task might include taking blood pressure, inserting catheters, starting IV drips, right, in some states, and charging bandages. They communicate with patients and sometimes patient family members to educate them in the care plan. Um, LPNs get their start by successfully completing a uh, practical nursing diploma program. These programs can be found at technical schools, community colleges, or career colleagues that can usually be completed in as few as 12 months. Okay. The next degree in nursing practitioners would be a registered nurse, also known as RNs. So registered nurses tend to be the group most people associate with the term nurse. Okay. They assume a wide variety of roles in patient care, and they are responsible for recording patient medical history, monitoring symptoms and medical equipment, administering medicine, establishing or contributing to a plan of care, performing diagnosis tests, and collaborating with doctors. They are quite important, right? In Spanish would be licenciada en enfermería de base, right? They are um, quite important for the medical staff. Some RNs can be responsible for overseeing LPNs, right? The other degree that we also talked about. They're overseeing LPNs, CNAs, and other healthcare staff. Specific job titles and duties would vary depending on where this person might work, right? And the last one is an advanced practice registered nurse, which is also known as APRNs. Nurses who earn this Master of Science in Nursing can become advanced practice registered nurses. And these nurses have all sorts of opinions when it comes to career choices. They can work independently as well as in collaboration with physicians, according to the BLS, right? That you all know about. They can perform all of the duties of an RN, as well as more extensive tasks like ordering and evaluating test results, referring patients to specialists, and diagnosing and treating ailments. You do know what an ailment is, right? We already talked about this term. An ailment is the same as disease condition. Okay, so these advanced practice registered nurses have a higher degree. They had postgraduate studies, so they are they have additional knowledge rather than a registered nurse. Okay, so we got to this part in which we are going to talk about the most common hospital departments. Okay, so here we have the accident and emergency department. The emergency department is also known as the emergency room, right? The ER. You already, you must have heard of it. I mean, there's even a TV show, which is also we just named after this, right? ER, emergency room. So this is also called casualty department, where a person is more likely to be taken if this person has arrived in an ambulance or emergency situation, right? So this is obvious, right? When a person has some kind of disease, an acute disease, right? Or has had an accident and an ambulance gets to the spot of this emergency, takes the patient to the emergency room, to the emergency department, right? Next, we have the admissions department. At the admitting department, the patient would be required to provide personal information and sign consent forms before being taken to the hospital unit or ward. If the individual is critically ill, then this information is actually usually obtained from a family member. The anesthetics. Uh, Doctors in this department give anesthetic for operations and procedures. An anesthetic is a drug or agent that produces complete or partial loss of feeling. There are three kinds of anesthetic actually: general, regional, and local, right? Well, so when we're talking about anesthetics, for example, I had a surgery and I had a nerve blockage, right? I mean, during the surgery, I just, well, they just blocked a nerve. So I was awake. However, I did not feel anything, right? So, what would be next? Breast screening. Screens women for breast cancer and is usually linked to the X-ray or radiology department, right? Well, next would be burn center. In a burn center, a hospital specializing in the treatment of burns, right? A burn center is often used for the treatment and recovery of patients with more severe burns. Okay. Here in La Paz, I just did not know anything like this department. Only plastic surgery and at Hospital de Clínicas, right, where I was a resident. So this department, in which plastic surgery is, it was also related to as a burn center, right? So next one, Central Sterile Services Department, also known as CSSD. It is also known as Sterile Processing Department, Sterile Processing and Central Supply Department, okay? This is a place in hospitals and other healthcare facilities that performs sterilization and other actions on medical equipment, devices, and consumables. So when we're in class, I asked you uh, the meaning of this word sterile, right? Which is actually the term for to describe something that is does not have any kinds of microbes on it, right? The difference between this word sterile and barren, this word that I already talked to you about, this last word, barren, Barren, describes a person who cannot have children, right? Who cannot have descendants. Okay. So, what is the next one? The next department. It is chaplaincy. Chaplains promote the spiritual and pastoral well-being of patients and relatives and staff, mainly some relatives, right? So let's go on. Coronary care unit. This is also known as cardiac intensive care unit, or CCU or CICU. Okay. A hospital ward specialized, it is a hospital ward specialized in the care of patients with heart attacks, unstable angina, cardiac dysrhythmias, that means arrhythmias, right? And other cardiac conditions that require continuous monitoring and treatment. It is similar to an ICU, right? That means an intensive care unit, right? Or critical care unit, but related to heart diseases, serious heart diseases, right? When a person has a heart attack, has had an angina, or arrhythmias that have to be monitored all the time, this department is where this patient is taken to. Okay, so that takes us to the next department, which is the critical care, also known as intensive care unit or ICU, right? So it is also known as intensive therapy unit, intensive treatment unit, critical care unit. So it is also known as ICU, ITU, or CCU. Okay. It is a special department of a hospital or healthcare facility that provides intensive care treatment, medicine, and caters to patients with severe and life-threatening illnesses and injuries, which require constant and close monitoring and support from specialist equipment and medications, right? This is where the most critical uh, illnesses are, right? So the next one will be the diagnostic imaging, which is also known as the X-ray department or radiology department. So this is where a patient may have an X-ray that we already talked about, and we are going to discuss later on more deeply, right? Uh, this patient may also have an ultrasonography study, which in Spanish would be ecografía, right? Also a CT, which is a tomography, computed tomography, that is what it stands for, CT, computed tomography. And some other studies like an MRI, right, that we already talked about last week, I guess, yeah, which stands for um, which stands for magnetic resonance imaging, right? And some other studies that are related to imaging. Next one would be the discharge launch. Patients who do not need to stay in a ward are transferred to the launch on the day of discharge, okay? Many hospitals now have discharge lounges with the facilities such as TVs, radios, puzzles, magazines, books, and newspapers. However, I did not get to see that here in La Paz. However, it should have a facility like this, right? A department like this for um, patients who do not need to stay and are discharged from the hospital. Next one would be the finance department. It performs all works related to the budget and ideal use of the items of such budget, right? Also, it prepares payrolls and monthly wages and concludes contracts of operation and maintenance and purchase cases, right? In addition, it makes available all amounts of money required for procurement of all materials and equipment. So everything that is related to budget that I already asked during class, the meaning, right, has to do with the finance department. Okay. So next one would be the general services. They support, well, the support services include services provided by departments such as portering, catering, housekeeping, security, health and safety, switch, laundry, and the management of facilities such as parking, access control, and all that kind of services, right? The next one would be general surgery. I mean, its name's it's already telling us what it's related to, right? It covers a wide range of types of surgery and procedures on patients. Um, the health and safety. This is important, and for all the well, for the staff of a hospital, the role of the occupational health and safety department is to promote and maintain the highest possible degree of health and safety for all the employees, physicians, volunteers, students, and contractors, and they actively participate in quality, safety, and risk initiatives. Numerous health and safety issues are associated with healthcare facilities, include bloodborne pathogens, uh, and biological hazards, potential chemicals, and drug exposures, right? Waste anesthetic gas exposures, respiratory hazards, ergonomic hazards from lifting and repetitive tasks, laser hazards, hazards associated with laboratories and radioactive material, and X-ray hazards, right? All kinds of dangerous exposure are related to it. In addition to the medical staff, large healthcare facilities employ a wide variety of trades that uh, have health and safety hazards associated with them. This include mechanical maintenance, medical equipment maintenance, housekeeping, food service, building and grounds maintenance, laundry, and administrative staff. Okay. Next one would be human resources. Its role is to provide a professional, efficient, and customer-focused service to managers and staff are in turn facilities, well, to facilitate the delivery of a professional, efficient, and customer-focused service to patients. The the infection control department is primarily responsible for conducting surveillance of hospital acquired infections and investigating and controlling outbreaks, right? Or infections clusters among patients and healthcare personnel. The department calculates the rates of hospital acquired infections and collates antibiotics susceptibility data and performs the analysis of aggregated infection data and provides comparative data to national brain benchmarks over time. So they control all kinds of information related to infectious diseases, yes, and how it is related to one unit to another, right? And when there is an outbreak, uh, it is this information is brought up to a national benchmark over the time. For example, when we have rabies, right? Um, One case of this infection might be related to the infection control. Okay, let's go on. The next one would be information management. There is meaningful information that could be used in quality management and continuous quality improvement and peer review, right? By improving the quality of information, core data, and that can be provided for randomized clinical trials, outcomes research, and meta studies. I wish we had this kind of department. However, here in Bolivia, we do not have enough research, right? So the next one would be medical records. That includes a variety of types of notes entered over the time by healthcare professionals and the recording observations and administrations of drugs and therapies, orders for the administrations of drugs and therapies, test results, x-ray reports, etc. Right? So all kinds of medical information that has of a patient who's ever been in a hospital is in this department. Okay, medical record department. The next one would be microbiology. The microbiology department provides an extensive clinical service, including mycology, parasitology, microbacteriology, and high security pathology unit, and a healthcare associated infection investigation unit, as well as routine bacteriology and an expanding molecular diagnosis repertoire. Okay, so it has to do with all types of microbes and how they develop, and also they might be helpful for diagnosis. An ending diagnosis, the final diagnosis, is related to it, such as pathology, right? So the next one would be nutrition and dietetics. Dietitians and nutritionists provide specialist advice on diet for hospital wards and outpatient clinics. So that means it's related to patients who are inpatients, which are staying at the hospital, right? Or outpatients who come to consultation. They have like a bond to endocrinologists, right? And some other specialties as well. The occupational therapy. It helps physically or mentally impaired people, including temporary disability, practices in the fields of both healthcare as well as social care, okay? Uh, they're often abbreviated as OT, okay? Occupational therapy, OT. Occupational therapy promotes health by enabling people to perform meaningful and purposeful occupations, and these include work, leisure, self-care, domestic and community activities, and occupational therapists working with individual families, groups, and communities to facilitate health and well-being through engagement of re-engagement in or re-engagement in occupation. The next one would be pain management, uh, which helps treat patients with severe long-term pain. Alternative pain relief treatments such as acupuncture in some countries, not really here in Bolivia, nerve blocks, and drug treatment are also catered for, right? Uh, this is mainly related to oncologic patients, right? Patients who have, well, are related to long-term pain. Will they tend to be part of the pain management department, right? The three last ones would be the patient services. The patient services manager is a source of information. It can be channel patient queries in relation to hospital services to the appropriate department. The pharmacy is responsible for drugs and medication in a hospital, including purchasing, supply, and distribution, and the social work. So, the social work, well, clinical social workers help patients and their families deal with the broad range of psychosocial issues and stresses related to coping with illnesses and maintaining health. Social workers, resource specialists, and advocates from a network that addresses the challenges families face. Increase accessibility to healthcare and other human services, and services serves as a bridge between the hospital setting and a patient's family life. Some will home and community, right? So, guys, I think yes, that would be the last one, the last slide. So, we are going to finish this class. Thank you for participating. Uh, Tomorrow we're going to have our practice class. Don't be late. Remember, we are keeping the 15 minutes per each student. It corresponds to each student. And take care. See you tomorrow.